Good morning. This is Mike Berkeley, the founder and director of the Berkeley Center for Reproductive Wellness. Good to be here. And so today I'm going to talk about why IUIs and IVFs fail. What are the potential reasons for failure in cycle outcomes? So they're multitudinous, multifactorial. So there can be poor sperm quality, which can be poor count, poor motility, which is the ability to swim, the ability of the sperm to swim, poor morphology, the shape of the sperm, the head, the midpiece, the tail. There can be white blood cells in the sperm, meaning that there's an infection. Volume can be too low. The male can have sperm DNA fragmentation. The woman can have an endometrial lining that doesn't get beyond 5 millimeters. There are very few, if any, documented pregnancies on 5 millimeter endometrial linings. She can have polycystic ovarian syndrome, endometriosis. In the polycystic ovarian syndrome population, the miscarriage rate is twice that of the non-PCOS population. Why? Because there's too much androgen that's not getting converted into estrogen in the follicular environment. And androgen essentially is an anti-estrogen, and so you have hyperandrogenemia leading to poor egg quality. And so this accounts for the high miscarriage rates in the PCOS patient. You have endometriosis patients that have had laparoscopies but still don't get pregnant because they still have endometriosis even though they had a laparoscopy, because the endometriosis sometimes looks like clear, clean, normal tissue. Diminished ovarian reserve. Woman doesn't have enough eggs. With diminished ovarian reserve, there's usually concomitant diminishment of egg quality. There are autoimmune mitigators. The body attacks the embryos because the body thinks that the embryos are cancer cells. There are blood clotting issues called thrombophilic disorders. This type of disorder can be responsible for second or third trimester miscarriages, or frequently and unfortunately stillbirths. So patients who are constantly doing IVFs, getting pregnant, miscarrying, or not getting pregnant at all, often say to their reproductive endocrinologist, this was a beautiful embryo, why didn't I get pregnant? And frequently the answer will be, it was just bad luck. Now, reproductive endocrinologists are some of the smartest doctors I've ever known. They're completely dedicated and devoted to their patients. They're sincere, terrific human beings who have chosen a life path to helping people start or grow their families. So I'm not in any way making negative comments about reproductive endocrinologists. I think they're the best thing since white bread. But reproductive endocrinology is limited, as are all types of medicines or medical interventions rather. All medical interventions are limited in their abilities, in their scope, because knowledge is limited. So what can the reproductive endocrinologist do about any of the pathologies that I just stated that can prevent one from getting pregnant, or that can cause miscarriage? Well, they can do absolutely nothing, any of those things, except treat autoimmune disorders. So if there are sperm problems, if there are lining problems, if there's a PCOS patient, they give the patient Clomid, they give the patient an LH mimic to make them ovulate, and they do IUI and they pray. The same with IVF. But what can they do about the fact that the PCOS patient has poor egg quality and is twice as likely to miscarry than the non-PCOS population? Nothing. So what type of medicine can help improve lining quality, can help increase sperm count, morphology, motility, decrease sperm DNA fragmentation, increase hemodynamics, which is to say blood flow, clear heat from the uterus? That's kind of Chinese talk, but translated into Western medicine, we can say reduce inflammation in the uterine environment that's being manifest as a result of endometriosis. This can be done with acupuncture and herbal medicine. So I guess my message to the patients or prospective patients that are listening to this video is that if your cycles are not working, it's not bad luck that's causing the cycles not to work. It's some pathology that's either been diagnosed but can't be treated, or you've been underdiagnosed. But there's always a reason why somebody doesn't get pregnant. And so I guess the message that I want to relay to the listeners is that since we know, since there's data, since there have been studies that attest to the efficacy of acupuncture in ameliorating some of the pathological mechanisms that I just indicated, that I just listed, it would be wise to include acupuncture and herbal medicine in your reproductive medicine protocol. Yes, of course, see a reproductive endocrinologist, but yes, of course, see a qualified, licensed, and board-certified acupuncturist and herbalist who specializes in treating reproductive disorders. Excuse me. There's a wonderful website, ABORM.org, which lists acupuncturists throughout the country that are certified by the American Board of Oriental Reproductive Medicine to treat fertility cases. These people have studied a lot, they've taken a board exam, they're very knowledgeable. So not every acupuncturist has the same qualifications as every other acupuncturist. For example, I don't treat back pain and neck pain. I just treat fertility cases. There are other acupuncturists that specialize in neck pain and back pain and don't treat fertility cases. What you want to watch out for is the person who's treating neck pain and back pain and says that they're also good at treating fertility cases. That's not possible. To understand and to be able to treat fertility cases takes 15 years of study and clinical experience. So I'm here to help you. If you're not in New York City, visit the ABORM.org to find a qualified acupuncturist near you. If you want to ask me any questions, you can call me at 212-685-0985. And of course, you can find out more about me and the Berkeley Center for Reproductive Wellness by visiting our website, www.berkeleycenter.com. That's BERKLEY center.com. Thank you so much for listening. Don't lose hope. Keep your chin up. You will get there. And I look forward to speaking with you again soon. Have an excellent day. All the best. Bye.